A career that many gravitate towards when in the health and medicine profession is nursing. Today we will learn the meaning of being a nurse, their tasks and skills, the education needed, and much more. What does it mean to be a nurse? Being a nurse requires sympathy and empathy for their patients, who are unfortunate enough to be met with a potentially life-changing event. Someone in the nursing profession should be selfless, professional, and compassionate. If you see these values in yourself, then nursing may be the right career choice. What do nurses do? Nurses are highly involved with their patients, providing them with hands-on care. Some tasks that nurses take part in are administering medicine, health promotion, and critical thinking and analysis. Nurses make sure that the correct dosage is given to the patient to ensure their recovery. They are also able to monitor the patient's health by interpreting test results from the lab. Nurses can communicate between patients and doctor and even the family. If these tasks interest you, then you may want to consider a career in nursing. There are a few skills needed to become a nurse: communication, assessment, and critical thinking. Communication skills are needed in order to clearly translate information between other nurses, doctors, families, and even the patient themselves. Many of us already have this skill down since our everyday lives involves communicating with others. Assessment skills are crucial because these skills help nurses determine a patient's state of health. With these skills, they can easily assess a situation, monitor it thoroughly and efficiently to solve any problems. Another skill needed is critical thinking, which helps us solve problems. Critical thinking for nurses can include diagnosing a patient according to their health history and then being able to readjust to the patient's rapid changes in health. We use critical thinking a lot when weighing out our options to solve a problem. The education to becoming a nurse only takes 4 years, which compared to other professions is relatively short. This 4-year period includes prerequisite courses for 2 years, followed by the actual nursing school for another 2 years. The prereqs have to be taken prior to applying to nursing school. These could include anatomy, physiology, algebra, chemistry, and psychology. The actual nursing school provides students with hands-on experience that include clinical rotations that allow them to apply the skills learned from the classroom. The typical day for a nurse is unpredictable, keeping things interesting and fun. There are different types of nurses and many unpredictable occurrences, so no day will be the same. Typically, nurses will obtain information on patients, perform bedside reports, plan out their rounds, review patients' medications, and check their diagnosis. Nurses must also document everything that involves patient care. Nurses are always on their feet caring for patients, so if you enjoy fast-paced work environments, then nursing may be for you. It is important to understand that anything can happen, so you must be prepared for the unexpected. Why do many people choose nursing? The salary is one of the reasons why. Nurses make around $37 an hour or about $75,000 a year. Nurses are always in demand, so there are open job opportunities for everyone. There are also opportunities to travel. But with all the hard work comes a lot of stress. Usually, nurses will plan out their schedule every other day or work for 3 days in a row and then have 3 days off. Because of the high salary, nurses may need to only work a few days a week. Is nursing perfect for you? Nursing is a hands-on job that isn't sedentary like desk jobs. Every day is a different day, so you won't ever be bored doing the same thing over and over again. Nurses, doctors, patients, and families will change your lives, but you will also change other lives and even save them. Education isn't as long as other professions, and you will still make a great amount of money even when just starting off. Many of these factors are the reasoning as to why many people have chosen the career of nursing. Why did our group choose nursing? Many of our close friends and family members are nurses, so they have inspired us to look more into their career. The duties of a nurse are also well rewarded. We believe that taking care of others is very important, not only physically, but also their psychological state. The education isn't as excessive as others, and the starting salary is great. Overall, the opportunity to change someone's life or even save it inspires us to choose nursing.